Today's speech topic is about the importance of good and effective communication in emergency medical services, or EMS. Today I'm going to cover 3 different areas that I think every provider should strive to improve and focus on in order to improve their quality of care. To become an EMT, you have to go on things called clinicals, which is a ride-along, but you interact a little bit more in order to get you some baseline experience and see if you enjoy the job. During one of my very first clinicals, I witnessed one of the largest failures to communicate I've ever seen. We got called out for a little boy who was seizing. By the time we arrived, the boy stopped seizing, but he was still in a postictal state, which means he was still very confused, anxious, easily agitated, and did not want to be touched. Normally this is something that we strive to work through, and it takes time because you have to try to get trust and build communication. But the main provider was getting extremely frustrated that we couldn't get any concrete vitals with our instruments. By the time we were in the ambulance, they had built up each other's aggravation to the point where we couldn't even touch the child anymore. We had tried getting a temperature and he had swatted it away, and this frustrated the main provider to the point where he started cussing under his breath and his face was red and very visibly angry, and we didn't get anything done. The reason I wanted to discuss that is because that's the worst case scenario, is not being able to provide treatment to patients that need it. Failure to communicate is an unacceptable standard that is simple and easily overcome. The reason I wanted to have my speech about this is in case anyone ever wanted to become an EMT or paramedic, they could maybe have a little bit more baseline on where communication needs to be improved and what to avoid. I myself am an EMT certified in the state and the nation, as well as taking classes to become a paramedic. The 3 main topics, or 3 main areas that I think everyone should strive to improve on is staying calm, establishing communication with the patient, and having strong communication skills with fellow providers. The first area I'm going to focus on is staying calm. This is one of the most important parts of our job, is to keep everyone calm. Calm provider, calm patient, easy treatment, faster transport, everyone is happy. If we are unable to remain calm, just like the example we previously saw, the patient may get more anxious. In a study done by the Review of Diabetic Studies, they saw that patient satisfaction scores shot up exponentially when the paramedics showed signs of a more empathetic or calm demeanor when treating. The number one way that I have found to always make sure to remain calm is to practice scenarios with a already experienced provider. They can act to their best ability to give you some scenarios so you're already prepared. So when you go into the real life and see some of those scenarios, then you're like, oh, I can do this. Something like a pregnancy, you can have a robot and it'll demonstrate a live birth, and it might calm you down a little bit before you have to catch it. The second area that you can try to improve on to remain calm is remembering that it's not your emergency. And I know that sounds harsh, but you have to make sure that you're not a part of the emergency, you're trying to solve the emergency. If you go in there and build the anxiety builds impatience. If you remember that this is something for you to solve, it might put you more in that puzzle-solving mindset and ensure that you are trying to solve and trying to help, not adding to the problem. Now that we've talked about preparing yourself to treat, let's talk about communicating with patients, and maybe more so talk about the barriers to communicating with patients that can pop up. Some main problems that immediately come to mind are language barriers, or the patient just mentally not be wanting to talk to you. This can be because of a traumatic experience, or they simply just don't want to talk. It is our job as providers to still try our best to communicate and get through, or we can't provide treatment. In regards to a language barrier, a fantastic and very kind thing that you can do is learn some very common languages. I myself have researched a little bit of ASL in regards to this project. I have learned a few words like hospital, help, diabetes, this is where, and then you can go hurt, is to ask where they're hurting at. Even in words like, you can learn some languages like Spanish or Korean, anything. Any small amount of words can help boost patient anxiety and relax them and ensure effective care. Another thing that you can do if the patient doesn't want to talk is a little different every time. Every scenario isn't going to be treated the same, and it cannot be treated the same. But the main point of reading nonverbal body language is the most important part. It takes a lot of practice, which goes back to those role-playing practice scenarios I brought up earlier. You maybe notice that they're walking with a little bit of a limp on one side. Maybe they're crying. Maybe they are clenching their fists and they're angry. You have to pick up on these little cues in order to provide the best care that you can without as much information as you have. Now that we've talked about taking care of the patient, let's move on to transferring the patient care. Now this can be because you've gotten them to the hospital, or they need a higher level of care that you can't provide, and you need to give them to paramedics, which is a high level of care. Now, according to Yasan Hamed, the author of The Effects of Communication in Pre-Hospital Care, 12% of patient incidents occur during the transfer stage. And while researching, finding that number blew my mind, because some things that can get fixed so simply should not cause that many issues. For example, if you want to, you should have a checklist of things when transferring over patient care. You should have maybe written down their history, their symptoms. You can write down the entire experience, just little jot down points, so you make sure you don't forget any parts of it when transferring care over. Another thing that you can do is always make sure to study up on your medical terms. If you maybe say just leg, they aren't for sure what happened. If you say there's a break in the femur or a break in the tib fib, they know what part of the leg something broke in. I hope after the speech that you kind of have a little bit more of a grasp of understanding of why communication is so important in preventing damage in the EMS service. You need to stay calm, you need to establish patient communication, and you need to make sure that you're communicating well with your fellow providers to avoid unnecessary pain. Some things I learned during my research was, like I said, I learned some ASL. That 12% number absolutely blew my mind for something that's so avoidable. The main point of this speech is to make sure that you understand communication is the most vital part of our job. If we miscommunicate, we cannot provide, and then nobody wins.